There used to be a slightly different model where you go to the dentist and the dentist would tell you what you were going to do, and that was the way it was. When I started working here a long time ago, there were conversations from the patient's point of view that weren't quite happening, stopping them getting a really good standard of care. My starting point is not saying, it's listening. Now the relationship with the patient is mutual. Most of the people who come here just want a good, regular professional service. Patients will have quite a detailed chat with me, so we get the big picture. We go through their concerns, what they're looking for as a result, time frame, what their budget might be, and then they have a consultation with the dentist to find out what they've got to start with, and then the dentist will give them verbally and in writing what they can achieve, what the steps of the process will be, and if there's options in the process, what the pros and cons of the options are. We provide general dentistry to good standard. We do cosmetic work all the time, and we do complex dentistry. We fix some things that people don't know are fixable, especially for maybe older patients who have been told a long time ago that the problem, there was no solution for it. It's important that they have a bit of time to orientate on what's on the table. We're flexible, so the people who are not interested in cosmetics, we don't talk about that. There's a niche of people who need a bit more emotional support, and we have to go into that side of it for them to make things happen. So we do that as and when it's needed. There's a link between people who are really terrified about coming to the dentist and people whose mouths are not in good condition. One of the main concerns that people have is that when they come in, they're going to get a big lecture. Like, why didn't you come a long time ago? And why have you let this happen? All the staff have training, psychological training in how to put people at their ease and help them manage anxiety if that's what they're experiencing. We also have another program for sedation to help them relax, which is different kinds of drugs to help them physically relax and emotionally relax. We do get approached from time to time by people who are having significant problems, either it's in their careers or with their self-esteem or in relationships, with intimacy, that their teeth are causing them major difficulties. So they're not actually necessarily nervous about treatment, but talking about something really personal like that is a different kind of a conversation. Standard expectation of people coming here is because we're on the Lisburn Road and it's BT9, that all our clients are from BT9. That would be 1% of our client base. The practice is founded as the local dentist for the Donegal Road and Sandy Road. That's what the practice was. My granny, would have saved up to buy my mum a good coat when my mum was a kid. And she would have saved up because she knew she was going to go down to Anderson McCauley's, wherever it was, and that it was going to cost big, but it was only done, once or twice a year. We have a lot of patients like that who have a high value on our services because it's really worth it for them, or they're very nervous and they feel they can't get quite the service elsewhere. You're aware of that? So you need to make sure that all your treatments are done properly and everybody's getting good value, no matter what sort of background they come from. We do work to budgets for people who are on a budget. We always talk about that up front so that we get the figures right. We have an extensive list of payment plans where you can pay things really slowly if you need to. For people with more complicated problems, there's two additional helpful things. Number one, you can do the treatment in stages, and it actually sometimes works really. You get a better result if you do it in stages. The other thing is that with complex dentistry, say somebody comes in with no teeth whatsoever and wants a full mouth of teeth without dentures, there are specific ways to do it cost effectively that the dentist can provide. And people often don't know about that until they come in. So again, that's something that we talk about every day. I think if we were going to do sort of a trimmed down, simpler service, I don't think our patients would like it. They want the best service that we can give them.